So how about we move to the next topic and talk about very small embryonic cells. I see that you use them. I've seen a couple of videos online of you talking on them, and it sounds like a very medicinal, amazing therapy for people.
Yes. So there's tons of exploration now into exosomes and bone marrow stem cells.
Right.
And, there's a whole industry now that's built up around this. And some really smart people figured out that there are these cells that are circulating around in our bloodstreams, which are called V cells. And V cell stands for very small, embryonic-like, they're not embryonic cells, but they're embryonic-like cells that are they're very small. So your average red blood cell is about 7 or 8 microns across. These are like 1 micron, they're tiny. They go through across the blood-brain barrier, they go everywhere. When the person was...
Which is an important distinction because stem cells don't.
Right. Most of the stem cells are given IV and they get stuck in the lungs.
In the lungs, right.
Okay? So if you got lung disease, it's pretty good. But if you got brain disease, they're not so good.
Right.
Sometimes they work in people. It's a good therapy. But this is a cut above in my experience. Because we've done both. We've done all the stuff. So when the person was conceived, these V cells were also conceived. And they've been circulating around in your body. But they never were turned on. They are dormant. They've been sleeping. One of the problems with taking a 74-year-old and taking my bone marrow or taking my fat cells and using my stem cells is those cells are old. Right. And how much, am I going to get from it? Okay? But if I've got cells circulating around in me, which haven't really been activated, they're new ones. They're not born yet ones. They're embryonic-like ones. Those are the ones you want.
Right.
So a doctor in California figured out a way that you could separate out those cells. So it's kind of like a PRP. You draw the blood, there's a special filter, it gets spun, everything gets trapped. So the filter's very small. So these 1 micron cells get through the filter, the rest of it doesn't get through. And he figured out a very, very interesting laser. So laser is light. It's a wave, a 3-dimensional wave. He figured out a way to split that wave, put it through a holographic filter so that the light wave turned into a combination of a light and a sound wave.
Wow.
So it's photoacoustic and it's pulsing. And if you shine the pulse on these V cells, they wake up.
Wow.
Now, you can experience this, and we do this with every patient that we treat this way. We draw the blood, spin it, hand the patient the vial that's got the separated V cells, and say, hold on to it, take your other hand, see if you can get, where do you feel them?
Wow.
Okay? And so these are separated V cells, non-activated. Maybe here, I'm not sure. Okay, good. Now, we're going to laser those cells for 10 minutes. Okay? And hand the vial back to the patient. Where do you feel them now? Oh.
Wow, man.
They're alive. This is like life force in a bottle. You can feel it.
That's amazing.
And we've done, I don't know, a lot of people on this.
Right.
And one for one, it's like, whoa. Okay? Now, an experiment was done with these cells where they were just put in a container and they sort of randomly wander around. If you take this laser and you shine the beam through the container, the cells will align where the beam was.
Wow.
They will come off the bottom and off the sides, and they'll line up along where the beam went.
Right.
So these cells are responsive to direction from the laser. So, depending on what the person's problem is, usually we do brain, thyroid, adrenals, ovaries, testicles. Okay, it's like a rejuvenation one.
Wow.
Okay, so the cells are now alive. They get injected back IV into the patient. Sometimes we put them way up high in the nose so you can get them straight into the brain.
Into the brain.
And then you laser these areas. and the cells will home there. They will go there.
Wow.
Now, I just had a very sort of fun thing happen. So I do triathlons, and I wear a heart rate monitor, and I monitor all my stuff. And about 16 years ago, I was in Los Angeles, and we were staying at a house that was, if anybody knows Los Angeles, it's called Echo Park, and at the top of Echo Park, there is a great big hill, and it's a third of a mile hill at an 18% grade. Wow. If you try to go up an 18% grade on a bicycle, it's very tough.
Very tough.
You know, you sort of have to do this because it's going straight up is too tough. So I have a very good friend. He was an Olympic cyclist, and we went for a 70-mile bike ride in the mountains around Los Angeles. And when we came back, it was about noon. It was over 100 degrees, and we're going to climb this hill. Okay?
Ouch.
And so we're climbing the hill, and I look at my heart rate monitor. It's 184. That's the highest I'd ever seen.
Wow.
Wow.
Okay?
At what age?
This was probably 20 years ago.
Yeah.
Oh, that's still like
So I was
100% running. You're running because usually I understand 220 minus your age is usually how you calculate. You know, if
Your maximum heart rate, but so it's in a.
It doesn't matter. You can bypass that.
Well, it isn't true.
Oh, it's not true. Okay, thank you. That's another thing for clearing it up.
Another debunking method.
Yeah, I understood that a baby was born and had a heart rate of 220, and that's how they measured. Okay, 220 minus your age. That's how you calculate your.
Yeah, it's not true. Anyway,
great.
So I saw 184. That's the highest I'd ever seen. Actually, the highest before that had been 172, and after I started taking Perfect Amino, it went up to 184.
Wow.
So I had a major improvement there.
Yeah.
But then 184, and I ride with guys here, and it's hot here, and I haven't seen above it 184 at all. So I get the V cells, and I've had a couple of doses of it, but on the second dose, I said, I want you to do my heart. Okay? So they laser my heart, I get the V cells, I forget about it. And it's like 3 weeks later, and I'm doing a triathlon here. And there's a couple guys in my age group that we're all very competitive with each other. So we come out of the swim, I'm ahead. We come off the bike ride, I'm ahead. I think I got about a minute on my next guy.
Wow, that's a lot.
Yeah. And it's, so the humidity is 95% and the temperature is 95 degrees. And I'm running, and I know he's coming because he's a little bit better runner than I am. And I looked down at my watch. I said, 186.
Wow.
Like, this is a new best. And then I'm like, oh God, maybe I should slow down.
No, keep it going.
So what hit me is that, so 74 years old,
Right.
V-cell treatment, 20 years before, I'd never, and I'd ridden hard, I've done hard things, but after the V-cell treatment, I got a 2-point increase in my maximum heart rate. And it probably is the maximum because I was still running, like I wasn't done. I didn't collapse. And I think it repaired stuff. Like it improved, whatever my basic genetics are, it gave me some new cells in there, which made this thing stronger.
Well, extended the life of it too.
Yeah.
Amazing.
So one of my nurse practitioners here has had a just terrible arthritis of her neck, and she's done everything. She's chiropractor. She even went and had a surgery and a fusion.
Wow.
Okay. And as a result of all this stuff, she has been unable. Her balance was bad, and that she had to be careful walking around, and that like in the shower, when she's washing her hair, if she'd close her eyes, she'd have to make sure that she was next to the wall so that she didn't fall over. So she gets the V cells. And it's probably 4 or 5 weeks later, she comes in here and she said, you know what happened this morning? She said, I'm in the shower, I'm washing my hair, and I realize I'm not leaning against the wall.
Wow.
And she says, watch this. And she comes into the room here, and she does a heel-to-toe walk all the way across the room with good balance, which she could never do before. She couldn't even do 2 steps before.
That's incredible.
Like, it's incredible.
That's incredible.
It's just, like, this is a healing therapy.
That's
and
incredible.
It's very amazing.
And very important, it goes around the political miasma that stem cells are. right? That we cannot use. Whereas the V cell,
Right.
there's nothing with fetal tissue, nothing.
Your
So
own-
this can be used.
It's your cells.
It's your cells
They're
that you
you.
get, yeah,
There's no, there's all these laws about how long they can be out of your body and what you can do to them. And these aren't really even processed cells.
Yeah.
They're filtered, laser. That's it.
And he has a great point. We've been in stem cell research for the last 2 years, and there's so many politics around. There's so many cancers, so many dangers. There's so many snake oil traders, right? And so you have to be very careful. So I think this is an amazing alternative for that, and you've seen a great results.
We're coming to
We're
train
coming.
with you. We're coming to get treatment,
coming.
train, and everything. That's
Yeah.
We're
amazing.
coming.
And you should. I'll put you in touch with the trainer, and you should go learn it. You should deliver it in your clinics.
100%.
For sure.
I mean, it's a fantastic
It's
therapy.
coming to MHI.
Yeah,
Yeah.
definitely.
Watch out, MHI coming
Hey,
soon.
Doc, just because I want to understand, you're extracting this no matter what age you are out of the person's own blood, right?
That's right.
So, correct me if I'm wrong. Usually with stem cells, when you're born and when you're a child, you have about one stem cell for every 10,000. Once you're like in your 60s, it's about like one stem cell for every 2 million. So using stem cells with an older person might not work well because they don't even have enough personal stem cells. So it doesn't matter if you're 90 years old,
You have
can
these
still,
things. You got these.
no matter how old you are.
Yeah, they're circulating. They're in your
Like
bloodstream.
a 15-year-old can have the same as a 60-year-old. You
Well,
can
No,
like-
extract
it's
the
about
like
the
he
blood.
was
same, but
saying-
there's plenty to go around.
There's a bug.
That's incredible.
Okay.
And one thing I read about V-cell is like everything else. If fasting tends to increase the number of V-cell, better diet, better nutrition, and high insulin tends to decrease it. So we go back to nutrition. We go back to the base. So yes, V-cells are important, but you know what? Like what's even more important is that nutrition, living a low insulin lifestyle, getting the right amount of protein and the building blocks, making sure your hormones are there. So it's amazing that everything always go back to this. But I love all these new technologies, these new treatments coming, because this is what's going to help us fight this tide of toxins and crazy exposure that we'll
And
get.
technology in hands of a healer, right?
Yeah,
which is
completely.
which is smart. Well,
Healer.
Completely.
Doc, you have been incredibly gracious with your time. We've infiltrated your office, so thank you for inviting us here. It's been amazing. I hope that all you guys at home watching have learned as much as we have. I mean, every time I talk to you, it's like I get I get an
Mind
education.
blown.
I get an education. So just to kind of wrap it up, so we don't infringe on your time. We kind of wanted to close it out with and I this might sound cheesy, and you get asked this a lot, but 2023. Everything that we've talked about, the toxic exposure, all this doom and gloom stuff that is constantly around us. What would your, maybe top 5 recommendations for somebody young or somebody in middle age who's maybe starting to experience these things?
Yeah.
What were your
Or to
5
prevent it.
Or to prevent it really. What would your top 5 recommendations be for 2023, if I may ask?
Like top 5, 3 to 5 biohacking
Yeah.
from Dr. Minkoff.
Drink his blood. That's what you got to do. I'll take some.
I think you have to start with basics.
Yeah.
You can't eat a bad diet and be healthy. Okay? So I tell people a good starting place for most people is sort of our version of a paleo diet. So it's organic. It's meat, fish, eggs, fruits, vegetables, nuts, and seeds. Okay? We take people off beans and
Grains.
dairy and grains, and we just start them on that. For many people in 6 to 8 weeks, their constipation gets better, their bloating gets better, their digestion gets better. And so that's an easy thing. Now, some people tolerate some of those other foods, and then they can eat those foods. But as a sort of clean the plate, that works for most people. I think everyone has to really be conscious of their metabolic health, which means glucose control. Okay? Probably 3/4 of the patients I see, I prescribe for them transcutaneous glucose monitors. And I say for 1 week, don't do anything except watch what you eat and see what your blood glucose does.
Right.
The Freestyle Libre is not very expensive. For
we use it.
around $70, $75 a month, you can get 2 14-day things.
Yeah.
And you can see. And it's remarkable. We're all a little bit different. So I come from a family where everybody's fat, everybody's diabetic, and everybody gets heart attacks. Okay? So my brothers and my sister and my parents, they're all like that. And I have their genes. Unfortunately, I have the same genes. You know, I've done 3 different gene profiles, hoping I would get a better result.
A better pool.
Never changed.
Doesn't
It
change.
never changed.
All right.
You know, so I know I got those genes. So I want to. So you know, if I eat vegetables and proteins, my blood sugar is great.
You do pretty good.
Okay, but I love black beans. So there's a very good little fresh Mexican restaurant over here. Okay. And if I go in there and I say I want a bowl, he said, "What do you want on the bottom? You want rice on the bottom?" I got 2 kinds of rice. No, I can't have rice. Okay, just give me cabbage on the bottom. Okay, and guacamole is fine, and chicken is fine, and the stewed vegetables are fine. Okay, and I eat that meal, and I'm probably going there. My blood sugar is 90. It's before lunch. I ate the meal. It maybe goes to 105. It comes right back down. Okay, and every now and then I feel dangerous. And I walk in there and I say, okay, just add a scoop of black beans on top. Okay, not a little bit, add a scoop. 160, 170.
Wow. Wait, black beans? What
That's
type of
a
beans?
huge
Black
spike.
beans.
Black beans. Look at
Black
that.
beans. Traditional, just Mexican restaurant, not refried, just black beans.
Interesting.
If I put a cup of blueberries in a smoothie, 160, 170.
Wow.
Okay, so I'm super
Blueberries,
sensitive. Now my fasting insulin is 4.5. Okay, and my A1C is low 5s. But if I didn't really watch it,
No.
I would be fat and diabetic, and just like my family members are.
Like that
So
old
I think,
know thyself.
huh?
Know
It's
thyself.
So I think part of this thing for people is you got to hook up with a practitioner that can guide you in this way. Like, what is the health path? And because the traditional path isn't a health path, it's a Band-Aid path. And that's not to say that doctors are all doing bad work. They're not. You know, you have a heart attack, you better go to the hospital. And if you need a stent, you better get it. And you need a bypass, you better get it. Because there are some miracles in modern technology.
For sure.
But you're not on a health path if you're in that bin. And if you want to get on a health path after you've been in that bin, you got to switch it around. You don't stop your medicines, but you go see somebody who can help you fix these things. And you know, it's crazy. Every morning when I get up and I drink my perfect amino, I got 38 vitamin tablets. Now, I don't like taking all those tablets.
We don't either.
But I know that that's the cost of living and trying to be healthy in the environment with all the things that we talked about.
Yeah.
But
Because
Mike
you
says
just-
all the time, I became a professional pill popper.
Yeah, I can take 6 things now.
Oh, I beat you. I take 12 at a time.
You take
I
12
ain't
at a
live in
time.
a world like that.
Okay, and just put them down.
Yeah.
Okay, so you need a coach.
Yeah.
You need to worry about your sleep. You need to eat good food. You need to get outside in the sunshine, and you need to exercise. Whatever you like, doesn't matter. You can play tennis, or you can do triathlons.
Be active.
Sunlight.
You know, I don't really consider bowling exercise, and I don't consider golf exercise. Okay, it's nice that you're outside and it's fun and all that stuff, but you got to move. You got to get sweated up.
Right.
You got to breathe hard. Okay, and you got to do something for your muscles. So you got to lift weights or exercise bands or you know, floor exercise or something. Do pull-ups, but you got to work on your muscles.
We
Those
like
are
to
really
call it
important.
bone weight resistant training.
There you go.
Because it's not just muscle, it's bone.
Yeah, and then dental.
Dental.
You know, a regular
Wow, look at
dentist
that.
is gonna put things in your mouth that you don't want.
I can
So
attest to
you
that.
want to see a biological dentist. There's a few organizations around. Maybe you put this in the show notes. but,
Biological dentists, that's what they're called?
yeah.
Okay.
And who can put the right materials in. If you have the wrong materials, they can get them out.
Yeah.
If you have root canals, you can get them out. And you know, there's a personal decision. You make this decision with your doctor. I'm not making you a recommendation. I'm just telling you that after seeing thousands and thousands of patients who are sick, who won't get better, our average patient in this clinic has seen 13 doctors.
Wow.
Okay? These doctors aren't stupid. They're smart. They're good at what they do, but they didn't
And they mean
figure
well.
out.
And they mean
And
well.
they mean well.
And they mean well.
Okay? They're good guys and gals. But they didn't figure out what's wrong with this patient. And when I see one of these patients and I look on the health history and it says root canal, I know I can fix that patient. Because 85% of the people that we see get better.
Wow.
And a lot of it's dental that was just overlooked and wasn't seen. So I send them to my biological dentist. We get the cone beam CT X-ray. There's pathology in their mouth. They have cavitations, which are holes in the jawbone where teeth were pulled. or they have root canals, and he fixes them up, and they come over here, and then we tune them up. We get their deficiencies and their viruses and their parasites and the rest of the stuff handled, and then they wake up, and they're good, and they're grateful, and they got a new life.
Wow.
And these are the things that it takes, and they have to eat the right diet, and they have to take the supplements, and they have to do all this stuff, and then they get better. Because really, when I was a pediatrician, what you find is that the really bad genetic accidents, they either don't make it they don't make it to be born, or they die of heart disease or deformity or kidney disease or whatever in the first 3 to 6 months of life. So that if a person made it past there, chances are their genes are actually okay. And they just have to figure out what is it going to take to keep them so that they're not medical wreckage. They're not on prescription things that are going to hurt them. One of the most dangerous places that you can go is a doctor's office. Okay? If you do a Google search for iatrogenic illness, iatrogenic means doctor caused.
Doctor death.
Doctor caused death. So it's either medications that shouldn't have been given, or it's complications from surgery, or the various things that can happen. It's conservatively 600, 700,000 people a year. This is just the statistics. These aren't mine. It's more than heart disease. It's more than cancer. So when you go to a doctor, you may need treatment from that doctor, and you should get it, but it isn't the answer that you want. At that point, you get the emergency fix. Okay, your blood pressure is 170 over 110. You better go on some medicine. But then, how's your magnesium? And how's your potassium? And how's your omega-3 fats? And how's your heavy metals? And then you go to someone who's knowledgeable in this area. How are your hormones? And you get fixed up. And then your blood pressure starts coming down. And you can wean off the medicine. And now you're on a health path. And now you can live a long time. And you can be smart. And be responsible, really.
Yeah, and then do the work, right? It takes work. It takes work. So
Amazing.
So you said 3 of them: Neolithic,
said like
paleo
7
diet. No, weight resistance training or active. Active, just be active. Weight resistance training. Your gums.
No, your dental health.
Your dental health.
You got to have a bowel movement every day.
Bowel movement, yes.
Every day.
Every day.
Okay? I had a nurse come in here with MS. She's in a wheelchair. Okay? She's a registered nurse. Worked in a hospital for many years. She's in a wheelchair. And she's got a diagnosis of MS. And so I'm talking to her. And I said, how's your bowel habit? Oh, just fine. Okay.
What does that mean?
What does that mean? Usually every 21 to 25 days.
What?
I said, really?
Wow.
I said, yeah, it's always been that way. Just figured it was normal. After about 25 days, I sort of get the feeling that I got to go.
Oh my
And then I go sit on the toilet and I go. Okay? So you got to go every day. Okay? A lot of people go twice a day, but you got to go at least every day. Okay? Like
Clockwork.
Like clockwork. So do you need some extra magnesium? Do you need some fiber? Do you need something? Whatever it is, okay, I just tell them, whatever it takes. Okay? And here's the things that you should take to go. You just got to go every day. A lot of these people on a paleo diet, they get off grains, they get off dairy if they're sensitive, they get off nightshades, they start to go because they're locked up.
No.
So that's another one of these things that's just really important.
Amazing.
Very good. Amazing.
Right.
I think the most important one that I learned here was the dental health. And even for our patients listening, I'm sure your patients know. Now you've had the experience. You saved his life.
Personal
Thank you.
testament.
We're going to go deeper into this also. Locate biological dentists in our area.
You got to give me 2 doctors. You got to give me 2 doctors' names before I leave today.
So watch The Root Cause, which is how we found out about that, and you'll have a complete different perspective on your mouth after watching that documentary.
Yeah.
The documentary is so good. It's so effective.
It's so good.
Yeah.
That the lawyers for the American Dental Association told Netflix, because it went viral on Netflix when after it was produced, that they couldn't show it because it was all false.
Yeah. I remember the story.
So where can you see it now?
Vimeo.
Venmo.
Yeah.
So,
All right. Well,
I
guys.
think maybe just one more thing.
yes, please.
All right. Keep going.
This is what living an optimized lifestyle does.
Yes.
A person is a sum total of the 5 or 6 people that they spend the most time around.
Wow,
Okay?
that's cool.
And if your friends don't have values that you admire
Change
and that
friends.
you want, change your friends.
Change your friends. I like
Because
that. I like that one.
Ooh.
you're
That's why
admiring.
you're my friend.
Doc, you
Or they say if you're the smartest person in the room, you got the wrong friend, a set of friends.
Find some more friends.
Yeah.
I love this. And the one, I'll add that for you because you said it. Think good thoughts, because our
good
thoughts
thoughts.
manifest our reality. I know Jay will like
things.
that.
They become things.
Jay Campbell will like that one, right? My God, this is amazing. Such enlightening conversation. Every time we meet, we learn so much from you. Truly amazing. Thank you.
And thank you for being what we like to bring back to the society. And we're trying to be very big on that. Is you're not just a doc, you're a healer, right? And I think that medicine has lost in its way, in its tracks, healers. You got to be a healer, right? And thank you for being a healer along with Dr. Ruth Everwine. So, well, guys,
right.
I think that pretty much covers it. Are you done?
I'm good. I'm good.
Okay. Well, we hope you've gained and learned as much as we have in this talk today. And if you're interested in further information on Dr. David Minkoff, you can go to LifeWorks Wellness Center or go to bodyhealth.com or simply give us a call and we'll point you in the right direction. Doc, I want to thank you for spending this time with us and for inviting us to this beautiful facility.
Yes.
And we look forward to your ongoing and pioneering work in this field of medicine, and that we may continue learning from people like you and other medical health experts.
Amen.
And for those of you at home, thank you very much for watching. Stay healthy.
And God bless.
Optimizing your health is only a scan away. Select the QR code that fits your profile best, and we look forward to hearing from you at the Medical Health Institute.